Hello, and welcome to Healthy Living. I'm Dr. Donald Pelto, and today I'm here with Dr. Lorraine Loretz. She's a duly certified podiatrist and nurse practitioner working in vascular surgery and is coordinator of a vein program locally here. Lorraine, thank you for joining us.
Thank you for having me, Don.
So today we're going to talk a little bit about veins, varicose veins. You've dedicated many years of your career to this. So let's just start out for everyone and talk a little bit about what types of problems can happen with veins.
Okay, well, veins are basically two problems that people think about with veins. As most people know, veins bring the blood back to the heart from the legs, and you can have what we call varicose veins, which are those large blue veins that you can see that can be problematic.
Yeah.
And then we can have what we call venous insufficiency, which is a little bit more than just varicose veins. It actually involves all of the blood flowing back in the deep system as well as the veins that we see with our eye. And those kinds of problems can lead to swelling in the leg and even problems with the skin or wounds and that sort of thing.
And is this a pretty big population? I know you see only that, but
Yes.
how many people have vein problems?
A lot of people have vein problems.
Males, females, kids?
We see more females because I think they're more conscious of the varicose veins and their appearance, but we see quite a few men who also have venous problems and venous insufficiency. So it seems to be pretty even, although there are certain types of subcategories of vein problems that are predisposed towards women, for example.
In terms of vein problems, who treats those? Is it their primary care? Is it a specialist?
Well, patients often go to a primary care source for their first evaluation, not knowing really where to go. But the vein world is really called the field of phlebology. And phlebology is the science of understanding venous flow, which is flow all back to the heart. And the phlebologists are pretty much under the hat of the vascular surgeons as being the primary people who are driving that profession. However, it has expanded to a few other specialties, the largest being the interventional radiologists, which are radiologists who do procedures and also will attend to venous conditions with those procedures. So we also see other specialists in medicine, such as internal medicine, go on and do a fellowship in phlebology and treat venous problems, with the exception of open surgery, which is limited to vascular surgeons.
Okay, so there's a little overlap for the non-operative care of veins. But in terms of if you're going to have a surgery, well, but I guess the interventional radiologist, was that considered surgery, or that's like a procedure?
They may do some of the surgeries. I don't know of any that do a full stripping procedure, but those procedures aren't that as common as they used to be. So they do quite a bit of work.
Yeah, and for all our viewers, the big question is, okay, I have varicose veins, but I've heard insurance doesn't cover them. Let's talk about insurance and payment for varicose veins.
We deal with that a lot. Insurance does pay for medically necessary treatment for vein problems. The medically necessary treatment would be in the case, most severe case, where you have wounds on the legs from venous disease or a large amount of swelling and fluid leakage, and it's really a quite serious disorder and debilitating, and of course insurance covers that. And they also will cover regular varicose veins that cause pain and disability, and that's where we get into a kind of a gray area that that we work out with our questioning and see, how disabled is the patient from this condition, so that they can use their benefits. The other types of things that we deal with the veins are the cosmetic issues, and those are not covered by insurance. And so, of course, most vein practices have a cosmetic arm to their practice and are able to service those needs.
Yeah, and do you also treat, I know sometimes we see patients with this really kind of, we call it real thick swelling, I guess we call lymphedema. Do you treat, is there special clinics for lymphedema, or is that within your hat as well?
Yes, lymphedema can be due to venous insufficiency. So there is different categories of leg edema,
Yeah.
which we can talk about a little bit. But it is something that we do work up, and what we do is we try to make sure that there's no vein component to the
Okay.
edema of the leg before we proceed with referral to a lymphedema center.
Okay, there's a
Yeah,
special center.
there
And
is.
when we're talking vein work like this, are we always talking from the waist below, or do you do any, I guess when people have other surgeries, there's some swelling, do you deal with that too, or is it primarily the others?
99% of
Okay.
it is from the abdomen and below.
Abdomen down. Okay.
And we do see occasionally a venous problem in the arm with some compression or an injury or
Yeah.
something. But by and large, it's below the waist.
Okay, okay. And then do you have some special tests maybe that no one else has? I know we do a lot of x-rays and MRIs.
Right.
What type of tests do you do?
Right. Well, the most common one is the ultrasound, and this is the one where if somebody, say, flies in a long airplane trip and has
Okay.
pain in their leg and they're afraid they have a blood clot in their leg, and they'll go to the emergency department or their primary care provider, and they will order an ultrasound.
Okay.
And this ultrasound checks for clots, and then of course if there is a clot, they're treated appropriately. But there's a second type of ultrasound called a reflex study, where we're not just checking for clots, we're also checking to see what direction the blood is flowing in.
Okay.
And if it's falling backwards towards the foot, that's called reflux, and we can measure that reflux, and in how many seconds it falls back. We can measure the size of the vein, and we can measure the pattern of the vein and where they end. And those are three very important things that we look for in those studies. And those are the ones that generally are ordered by the vein provider.
Okay, I think that's a great point. We can kind of go into now talking about the anatomy. So people, they
Sure,
heard the
sure.
word reflux, but let's understand how veins work normally, and then a little bit about the reflux and things like
great.
that.
Well, I always like to look at veins sort of like a tree,
Okay.
where the trunk of the tree is the main deep vein that comes from the belly and divides and goes down into the leg, and then there are branches, which are the named veins, and then there are little twigs, and then the leaves are those little spider veins that we see, and there are also some deeper ones there. We want to remember the function of veins. Basically, the body has a very sophisticated plumbing system, with the center being the heart, where the heart pumps and squeezes the blood out through the arteries, all out to the head, the arms, and the legs, and nourishes all of the tissues and organs. And then the oxygen exchange goes on, and then the blood has to come back to the heart. And the way it does that is through fluid mechanics and pressure. So it has to have enough pressure caused by the heart and the arteries to push the blood back. So when it's pushing from the foot, for example, it has to push up. And so it loses some speed, as you would expect, as it goes up. So if you think about your blood pressure, what's your blood pressure, 120 maybe?
Pretty good, 120
All
or
right, 120, all right. So you have 120 going down,
Okay.
but coming back up, you're going to start to lose steam. You need 40 to get the blood out of the leg.
You need 40 to get it out.
If
Okay.
you don't have 40 millimeters of mercury of pressure coming out of the leg, the blood's going to fall back, it's going to swell, the skin's going to start to stain, it will make changes, and you may have some symptoms, some pain. And so we often replace that pressure with a compression stocking or a garment to push the pressure back in. So that's how veins work.
So just for those that are listening, this is curious. So can you give someone just more pump from the heart? Is that something that helped? Can you increase that 40 to 50 to 60 without something external, or pretty much?
Theoretically, that's a good question, but remember, it's the resistance coming back up against gravity. So there are certain things that make that pressure worse. If you may hear about women when they become pregnant, as they get bigger, they start to develop veins, pop out everywhere, and then that's very common. We see that a lot. And what is happening is the girth of the belly is pushing down, and that vein has to fight against that pressure to come back up, and just really can't handle it. And the little valves in the veins,
they give out.
I have a little diagram. The little valves that are in the veins to hold, that normally they close when the blood falls backwards against gravity, but the vein stretches, the blood then falls back, and these little valves are now floppy and not working anymore.
Okay.
And then the vein gets larger and larger and causes more symptoms. And that can be other causes. You could have a tumor in the abdomen that can cause that. You can have obesity is a large cause of that.
Now, after you have the baby,
A
will,
lot.
will they go away? Will they stay?
Yes, once the pressure is off, a lot of the veins will shrink back.
Okay.
But they've stretched a bit, and they can come back with vigor at the next one. And sometimes they don't. get better, and then they become symptomatic, and we can fix them.
That you need treatment. So that's exactly what we're going to talk about next. So when do they need treatment?
Well, what we treat, and I have another slide here, and the vein system in the leg, remember it all starts at the toes where the turnaround comes back up through the veins, and there's really two systems in the leg. There's a deep system, and then there is a system we call the superficial system, which is next to the skin. Those are the ones you see. The deep system, you can't see those veins, but that's the very important system that is responsible for delivering 85% of the blood back to the heart. That's the system, if you get a blood clot in your leg, that becomes serious and you need to take blood thinners for a while.
It's one of the deep ones.
That's right. It's to prevent that clot from going to the lungs and causing what we call an embolism. And so varicose veins are really in that outside superficial system. And what we do is we measure the amount of backflow or reflux that's occurring in those veins, and then determine where we can sort of shut off the spigot, so to speak. And all of these vein systems, the deep one and the one close to the skin, are interconnected. So we actually measure all of those pathways, and it gets quite complicated.
Do you have to do them one at a time with this little Doppler, or is there something you strap on all the legs and it does it all at once?
Well, it's an ultrasound, and they go through and they
Someone
press
else does that? You do that?
No, the vascular technician does that, and they are all certified and trained, and they create a report
map or something.
It's like a radiology report, and then the physician reads the report and reports on the findings.
So based on those findings, then you can look at those findings and say, okay, this person, they just need maybe special socks, or these people, this person's going to need a surgery.
That's right.
So you make that
so
determination.
The first thing I'm looking for on a report is, do they have deep reflux of the deep system, or is it just in the superficial, the saphenous veins, we call them, end branches of those veins that are close to the skin? Because if it's deep reflux, we don't have any treatment for that.
You can't wear compression stockings.
Well, we don't
have
any surgical treatment for that. We can't fix it. But we can, of course, prescribe a compression stocking or a garment or some other things that they can do, exercises and such. But there's no cure in terms of a surgery. If we have the reflux in the superficial veins that you can see, we can change those. We can either close them, or they can be removed, divert the flow to another vein, ideally deeper and up.
So let's talk a little bit about these treatments now that you can use. Is there new technology? Has it been the same for 30, 40, 50 years? How is it, what's always been done, and what are kind of the new things that are in the forefront?
Sure. The traditional vein treatment was the old stripping procedure. People, probably maybe their parents or grandparents, had these kinds of procedures. In fact, when I was a resident back years ago, I did a vascular rotation and we stripped all the veins.
And did it work?
It does work. It does work, except that, remember, when you take one vein away, the blood's going to go somewhere else, and eventually over time, another vein might pop out. I call it chasing the vein. All right, so that's the old procedure. We don't do strippings very much anymore because most of the veins can be closed through a catheter that we start like an IV in the vein, and then we close the vein with some kind of energy. So that type of procedure, it's called endovenous ablation.
So basically you take something, put it into the vein, and then it's either a chemical or heat or something, and as you pull it out, it'll close it.
Exactly. So the two main veins that we do with that are, like in our diagram, are the saphenous vein that runs from the groin down to all the way to the inside, to the big toe, but we treat the vein between the groin and the inside of the knee, and close the vein there. And then there's the small saphenous vein, which starts behind the knee and then fills the back of the calf and goes down all the way to the ankle. And those two veins, of course, have interconnections, but those are the two ones that we direct our closure procedures to. So we determine first that they have this reflux on the ultrasound, and it has to meet certain numbers in order to be covered. And then we can very simply start an IV near the vein. We thread a catheter through that's going to deliver either heat or a laser, and we turn the machine on and pull it back, and it closes the vein. And it's fairly quick.
So this type of procedure, is it done at the hospital, and is it in a clinic setting?
Either, it can be either, but we do our procedures now in the office.
In the office?
It's very nice.
Do you need like an anesthesiologist or someone to help?
No, we don't need anesthesia for this. We use a local anesthesia.
Okay.
So the skin is numbed up where we insert the IV, and everything's through that. The anesthesia is flooded into the vein so the patient doesn't feel anything. It's fairly quick. After it's done, the leg is wrapped up tight, and patient walks and goes home and resumes their business. They're a little sore on the inside of the leg for a few days, but by and large, it's a pretty good procedure. And
then you have to use compression stockings after, or you're good to go?
We recommend a compression stocking for a week or two afterwards, and then we see how the blood is diverted from the veins that were problematic. We have to keep an eye on it because now the blood is readjusting itself in the leg.
To where it's going to go.
Right. But almost invariably, people think their leg feels lighter, the pain is not there, the veins are reduced in size, and if they have skin condition or something we call an ulceration, those invariably heal after this. So it's good.
Are there other types of like these invasive procedures? Like are they injections? You can inject them sometimes? Right.
Well, there's two basic types that are done for these larger veins like this, and the first one is a newer technology. It's called a glue, and basically the VenaSeal procedure is where instead of threading a wire and then heating the vein and closing it that way, they injected this special glue that just glues the vein shut. And we're in the process of trying to get that in our center.
Interesting.
And it is pretty cool because there's really no downtime after that. The second procedure that is done in that way is with a product that is injected into the vein in the form of a foam. And it is called foam sclerotherapy. And sclerotherapy is an injection on a vein to make the vein collapse. We do that for some veins, for some branch veins, usually not for the larger veins.
Okay, so the smaller ones, what are the spider veins that people might see?
Well, that's a little bit different. But no, this is for symptomatic veins. For larger veins, the vascular surgeon may choose to inject a foam, and they have to do this under ultrasound guidance so that the foam does not go into the deep veins. That's important.
Okay. All right. And so those are for the deeper ones, we're talking surgically covered.
Ones.
Okay, let's talk about the cosmetic ones then a little bit.
Sure, a very popular topic.
I'm sure everyone watching. Let's get to the cosmetic. How do we take care of this?
Come on in, get in line. I love doing veins. I do most of the cosmetic injections where I work, and it's been something I've been doing for quite a while. It's almost an art. And what you want to do is, these are the little spider veins that look awful. They're blue, they're clustered. Sometimes a person will come in and say, my grandchildren tell me I have bruised legs, but it's these veins. And they don't bother me, but I just kind of get rid of them. And sure, we can get rid of them. It's a series of injections in those veins with a special product. There are a variety of different products used, but there's one main FDA product which is the one that we use for that purpose. It's really the best product. And we very slowly inject the vein.
Do you need ultrasound for that too, or is it just visual?
We do not. It's visual. I do use a vein light, though. I like to see deeper because I want to get the feeders that are coming up to the surface of the skin that are feeding that vein and causing it. If you just shoot the veins in the skin, they're going to grow back if you don't get the feeder. So I also use magnifiers so that I can see very, very clearly and be very accurate. It's like shooting ski.
Is it one time, or do they come back a couple weeks later and just take a look again?
Most people need several treatments. It isn't. We might inject all the veins in a certain area, and we can cover quite a bit in one session of sclerotherapy. But some of them won't die. They're just very stubborn, and they want to stay alive. And despite all we do with compression stockings for a week or two after, they still will require a second treatment. And I usually time those 6 to 8 weeks after the first.
So just a question from my understanding, could you treat the deeper ones and these other ones on top go away? Does it happen sometimes? Like let's say the deeper ones really hurt and you're treating it, will these other ones, cosmetic ones, kind of resolve?
You would think they would. The pressure is off of them, and if they were bulging a little bit before, that will be gone. But the veins will still be there. They'll still be discolored. So the way that we treat veins, if we have very large veins with this reflux condition, we treat that first. We get the big ones first. And then we can go after little branches and then the very tiny spider veins.
Okay.
The very smallest ones, and this is really maybe my younger women patients who are more concerned about the very tiny red hair-like veins that can occur on very clear skin. Those are best treated with a laser, a skin laser that just basically zaps the veins. But most of the veins don't fall into that category.
Okay. That's a very specific niche. Yeah. And let's talk a little bit about, there's probably a lot of people watching, they're thinking, well, I'd like this vein surgery, but I haven't even done the basics of treating my veins. Should they see someone? Can they try compression stockings? Let's talk a little bit about the stockings.
Right, we sort of put the cart before the horse.
Yeah,
we talked about the treatment before what we do for symptoms.
Yeah.
But there are several things you can do if you have varicose veins that bother you, or you have other kinds of venous disease that is producing changes in the skin, etc. The mainstay of vein care is compression therapy with the use of some kind of a stocking or a garment. And compression therapy, I brought some stockings to show you.
Yeah.
It's come a long way, so I'd like to show you and then mention a few other things that we also do. People have this image of this large latex type rubber stocking
that goes up to here,
and straps around your waist, and we do still have those if you want them. But veins have come a long way, and you can see we've got colors and shapes. We have this is a gentleman's stocking that has ribs in it, and it looks quite nice with the dress slacks.
Yeah, it looks like a dress
It comes
sock.
in every color. And we have them all sorts. We have tie-dye, and this one, as you can see, is toeless.
Yep.
So you can wear sandals with it. Boy, wouldn't that be a pretty sight at the beach. And the tie-dyes come in every color you can imagine. There's stripes. These come in hot pink, too. There are sports
For
versions.
like runners and things.
Perhaps you've noticed the athletes
All
have
the
taken
athletes
up
are
or wearing
yeah.
compression garments. I don't know if you watch the NBA finals.
And a lot of the long
they
distance
all wear them.
runners and marathoners, everyone's, why are they wearing them?
They're wearing them to secure the venous pressure and make sure that you have enough pressure to send that blood back efficiently. So it's pumped efficiently. If you've ever seen an athlete after a competition, their veins are engorged. And it is a kind of a waste of energy to kind of keep the veins down there. So it does work quite well. So there are the sports models, and they count, you know, as compression therapy. We have fashion colors. Look at this. You can match every outfit I have.
Oh my, look at
We've
these.
got all sorts.
Now, are all these, I know they talk about different percentages or millimeters of mercury.
All of these are 20 to 30, which is the standard we use for veins.
That's covered by insurance, 20 to 30.
20 to 30 is covered by some insurances.
Some insurance, okay.
It depends. It's very specific.
Or you can just purchase them online. Is there a good,
You can.
you know,
Yes, there's plenty of websites.
just Google
Very
it.
competitive market.
Oh, good.
Although it's always nice to have them fitted by a certified compression garment fitter at one of the medical stores. You get a better fit. You might have more choices of product and some help in learning how to put them on.
Yeah.
Veins also come in, compression stockings come in sheer, so you can see how
So
nice
they
and sheer
look like
that
a
is.
nylon or something.
They look like a nylon, but this is 20 to 30 millimeters of compression. They come in thigh high, and they're long ago we had the rubber tops, but now we have the silicone bands. We even have these nice lace bands. Ooh la la. And some of these also come in the sheer, but they're a compression stocking. You can even get some fancy patterns. You know,
oh, look at that.
the Harlequin weave there in every color. They come in black and gray and everything else in between.
Wow.
This one's toeless.
Yeah.
So you can see the technology has really come a long way, and pretty much if someone needs a stocking for vein treatment, they can find something that they will be able to tolerate and wear.
Yeah, yeah. So let's talk a little bit about the basics of these stockings. When do you put them on? Do you have to wear them forever? Can you sleep with them? Just simple things like that for those that are listening.
The idea is to wear the stocking when you're upright.
Okay.
So you put them on in the morning, take them off in the evening, and you don't need to wear them to bed.
Okay.
You know, the type of stockings that are sometimes prescribed for people are after surgery, say for example, these are anti-embolic stockings to prevent a blood clot because of bed rest.
Yeah.
And but this is really used to treat to help divert the blood and give a little bit of assistance for the blood to return to the heart.
Okay.
So there were a few other things that we do besides
Good.
stockings.
Yeah,
I
let's
wanted to
talk about
mention.
those.
Another one is leg elevation. Periodically, putting the leg up and elevating it will take the pressure off and allow the blood to return a little bit more efficiently.
So how high is it above the heart? Is it just any little bit
Ideally.
helps?
Ideally at heart level is really the best, or above. If you just put them up on a stool and they're hanging down still, it's probably not going to help a whole lot. It might make your feet feel better, but not your legs. Another treatment that is generally recommended for people with vein symptoms of pain in the leg from varicose veins is use of an anti-inflammatory like ibuprofen or a pain medication like Tylenol or acetaminophen. And these medications are shown to reduce the inflammation that occurs and the pain with some of the veins. And in fact, insurance companies want all of these things used for a period of time before they will cover a procedure to change a vein. So that's very important. The other thing, of course, is exercise, because exercise engages that calf muscle, which helps to act like a pump. Exactly. And also maintaining a normal weight, because we don't want that pressure pushing down.
So just like the pregnancy, the being overweight can affect that
almost
too.
the same way, yes.
Now let's say these help. The biggest complaint that I hear from my patients is, how do I put them on? Are there some tips that you can give people?
Sure, I guess
the $1 million tip here, how do you put on a compression stocking?
If you are fitted at a vendor, they teach you, or they should, you know, I ask that they do, and they will teach you how to put them on. And you can either, for example, on a stocking like this, you could take it like, you find where the heel is, and then you kind of roll it down.
Roll it down,
If you do this, you'll never get it on because it's too tight to pull around the ankle. But if you roll it in half and put it on like that, and then you slip it on over the foot this way, it goes in that way, and then you can pull the rest up. And so that's my best trick. When we have patients with very serious wounds on the leg, sometimes they need to wear a double stocking or an extra tight stocking, and they're hard to get on. And the tip for them is to put a very lightweight, even lighter than these, a very light. Sometimes I say just go get one of the legs knee highs in the grocery store and put that on over any bandages you may have. And then you could slide the big one on over that. It will slip on. It will slip on easier. And it usually has open toes, so you can pull the toes out a little bit, or even pull the other sock out.
There's a device, I'm sure there's some devices you can use. The Dolphin Donner is kind of one that's kind of popular these days. There's so many different types of devices.
We call them butlers.
Butlers,
right. We call it compression garment butlers. And there are all kinds. There's the big metal cage where you put the stocking on the cage, and then you put your foot in.
I guess whatever works.
Pull it out, right. Then they have the one that is a sort of like the sock trick I told you, where it's a taffeta sheath that you put over the leg and put the stocking on and then pull it out.
So there's a lot of different
There's a lot of different ways to put them on. It is difficult though. When you have a patient who has a problem with their hands, with arthritis, maybe they're older and they can't see so well, or the obese patient can't bend over and reach their legs. And those are always challenges for us to get compliance with using the stockings. They're so important for the more serious vein problems that we have.
Well, very good. Thank you, Lorraine.
Sure.
Dr.
Well, thank you for having me,
It was wonderful having you here
really
and this episode.
Thank you.